Welcome to Doctors on Call. I'm Jenna Miller. Good oral care is one of the most important daily habits a human being should practice each day. Did you know the average American spends nearly 39 total days brushing their teeth over a lifetime? And while that means the average person spends 45 to 70 seconds a day brushing their teeth, the recommended amount of time is 2 to 3 minutes. It's no wonder nearly 80% of Americans have had at least one cavity by the age of 17. So what can you do to protect your dental health? Today on Doctors on Call, we'll learn more about dental health and how it's important in preserving your overall health with Dr. Jarrod Jones.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Our topic tonight is dental health. Dr. Jarrod Jones is a native of Central Kansas, growing up in La Crosse, Kansas. Upon high school graduation, he attended Kansas State University and received a BS in agriculture. Dr. Jones attended the University of Texas Houston Health Science Center dental branch, and in 2003, Dr. Jones received his Doctor of Dental Surgery degree. In December 2004, he bought Dr. Mark Ruthlefson's practice in Hayes and was in solo practice until January 2011. At this time, he combined his practice with his brother's practice, forming Cedar Lodge Dental Group. In January 2019, Dr. Jones opened EyeSmile Vision and Dental with his wife, Stacy, who is an optometrist. Dr. Jones is a member of the Academy of General Dentistry, the American Dental Association, the Kansas Dental Association, and the Oil Belt Dental Study Club. Since 2013, Dr. Jones has been serving as the honor of the governor of the state of Kansas as the member at large on the Kansas Dental Board. In 2017, he was reappointed and is serving a second 4-year term. He is a graduate of the Coy Center in Seattle, Washington, an advanced postgraduate program for practicing dentists with the latest advances in aesthetics, implant, and restorative dentistry to continue to better serve all of his patients, young or old. Give us a call at 800-337-4788 toll-free with your questions about dental health. On Doctors on Call, our show brings you information which may be useful to you when you visit your own physician or dentist. Thank you so much, Dr. Jarrod, for coming on our show tonight. We've got a lot to cover. Let's talk about, first of all, what should someone look for when they are selecting a dentist?
I would say, the most important part is someone that you can relate with and develop that relationship with, be able to talk with them in depth about the issues you're having and develop that trust with them and establish some rapport. That'd probably be the most important part from that standpoint. Yeah.
And how often do you think a person should visit a dentist?
Oh, without a doubt. I mean, it's recommended every 6 months that you have a cleaning. Some people, can get away with possibly yearly, but every 6 months is by far the best. And, prevention is the best and cheapest cure from that standpoint. Yeah.
What symptoms might a person be having that may need to take an extra trip to the dentist?
Well, if you notice brushing, when you're brushing, if you have bleeding gums, if you have any loose teeth, things along that line. If you start to notice any dark spots on any of the teeth, those to me are high signs, both visual, that indicate that you probably should see a professional for some dental care of some sort. Yeah.
Let's talk about the importance of periodontal health and how it relates to a person's overall health.
Okay. Well, we're learning more and more about periodontal health and how much that ties into our whole health. They've for sure tied it to heart disease, increased risk for stroke, a lot of those aspects. So when it comes down to the periodontal health, it's very important. It's the gateway to the rest of the body, that we keep that healthy. And also, if you have diabetes, you're more at risk for periodontal disease and having issues from that standpoint. So we want to stay on top of that and make sure that we keep those things under control.
And what exactly is periodontal disease?
So periodontal disease is when the body gets inflamed and we have bacteria there that causes an inflammatory response within the body. And so when that happens, the body takes a different route and starts attacking itself as well as the bacteria in that. And so it's what we call host modulated disease. And so that ends up causing the bone to recede away from the teeth. Therefore, you end up losing the teeth over time if you don't get that taken care of.
And if a person is at that point, what do they need to do?
So anytime, like I say, if you notice any mobile teeth, if you notice any recession of the gums around the teeth, that's when you need to come in and have an evaluation and make sure that we don't have bigger issues going on. So you definitely want to get in. We go around the tooth, we probe it, and we take measurements to see how deep those probing tips are. Do we have bleeding when we probe around the teeth? If we have those issues, then we prescribe the appropriate treatment for those conditions.
Is there a way that this can be prevented?
For sure, regular visits, if you'll come in, and usually with a periodontal recall, we're going to see it probably on a 3 to 4 month interval rather than the normal 6 month, because we want to stay on top of it. Sometimes we'll lengthen it back out to 6 months depending on how you respond to treatment. But normally it's going to be 3 to 4 months that we perform treatment, 3 to 4 month intervals that we perform that treatment. But once you have the disease, the thought is that you've got that for life, and you have to take care of that and stay on top of it. So.
Okay, well, we're going to go to the phone lines. We've got Jean on the line from Hayes. Hi, Jean, go ahead with your question for Dr. Jarrod Jones tonight.
Yes, about 3 years ago, my husband was told he needed a root canal. Well, after checking it out, he thought it was too expensive. So last fall, he pulled the tooth out himself. I am wondering if this is going to cause problems down the road.
Thanks for your question, Jean. Once the tooth is out, the reason it probably needed a root canal was either it was infected due to the nerve dying or something along that line. And so if the tooth was taken out, there really isn't any acute issue with infection or anything like that. What I would be more concerned about is down the road, having issues with the bite collapsing, teeth shifting, things along that line. Once you take the teeth out, they lean on each other for support. And so when you start taking them out, you're still biting with the same forces and that can change the makeup to where the bite changes, and you can have other issues there where you have abnormal wear patterns on the teeth or premature loss of other teeth because of those forces that are being placed on it. So that would be probably my bigger concern from that standpoint, is just the overall health of the entire dentition, not just that one tooth.
So you wouldn't suggest somebody extracting their own tooth?
I don't think there's enough whiskey in Ellis County for most people to pull their own teeth. Some people can do it, but I always joke with my patients about that. I've had a number come in over the years that say they tried, but they just couldn't do it.
Okay.
So.
All right, very interesting. Let's talk about tooth decay and how that begins.
So, tooth decay is an interesting process. So, we were always told not to eat candy as kids, things like that. Well, yes, but the problem with that is we didn't understand the processes behind it. When I graduated from school back in 2003, we were taught there's only 3 or 4 main bacteria that cause the caries process. Well, in the time since then, we've found out there's thousands of bacteria that love an acidic environment. And you have to remember, cavities are a pH issue. So whenever you eat sugars, whenever you have acidic drinks, soda, Gatorade, Even milk has sugars in it. If you drink those, it takes that mouth, if you've got the right bacteria, it becomes a more acidic environment. So that bacteria change that sugar into acid, which they then, what we call poop, out on the teeth, and that ends up eating away at those teeth. So that's the cavity process. So we want to go in there and we want to shift that pH back to a more normal or a more neutral pH. The magic number is 5.5. So once the pH in the mouth goes below 5.5, I always tell my patients, you picture that tooth kind of like a chicken wire with concrete on it. So when it gets below 5.5, that concrete is coming off of that chicken wire. Once you get above the pH of 5.5, that concrete's being attracted back to the chicken wire, and the teeth are getting stronger. So we want to stay in that process, but the problem is a lot of people will drink sodas and they'll just sit there and sip on it. And every time you sip on it, that takes that pH back to a more acidic level. It takes about 15 minutes to buffer back to the pH of 5.5. And so by that time, you've taken another sip already, and that process just keeps that mouth at a constant acidic level and creates a great environment for the bacteria that cause decay. Once that shifts, then that acidic environment isn't good for the good bacteria in our mouth. And so the others can just take over, and then that's when we end up losing our protective factors. And there's a lot of factors that go into it with the saliva, and that there's a lot of factors from it that may be protective, that say they get put on a medication that reduces the amount of saliva. Then that shifts over, and now you become more risk for caries. So you start having more decay and cavities and things like that because of that one thing. So several things added together end up causing issues there.
So how important is saliva for a person's mouth?
Saliva is very important. We're learning more and more the importance of it, the different, all the minerals that are in it and different things that help to bathe the teeth, protect them, the immune response from the body that attack those bacteria, and viruses and even yeast as far as that goes. That all plays an important part in keeping the cavity process in check. So, and the cavity process, another thing people have to remember, it's what we call a biofilm, as well as, periodontal is another issue. So you have these bacteria that come in here, and if you don't brush your teeth, you end up with this pellicle that forms around the teeth. Well, if you don't brush your teeth over a long period of time, that pellicle just keeps getting bigger. Well, on the inside, you don't get a lot of oxygen there, so you get the bad bacteria that they don't want oxygen. So they build inside there, and that's where we have more of the bigger issues, where the periodontal bacteria get into the bloodstream, and then it gets into the plaques in the arteries and heart disease, those kind of issues as well. So that's why we want to keep that pellicle cleaned off of there so it doesn't calcify and become a bigger issue over time. We want to keep everything nice and clean and keep the bad bacteria out of there.
Sure. Now, is there a difference between tooth decay and cavities?
So tooth decay, cavities, same thing. Yep, it's basically whenever that tooth, a lot of times the tooth will form and you'll have grooves in the teeth, but they don't fully fuse together. It leaves like a little teardrop in there. And so the bacteria and food get down in there, and they cause decay down in the tooth. And after a while, you get decay down in here enough that the dentin doesn't support the enamel that's above, and it ends up cavitating or falling down into the tooth, thus calling it a cavity. So that's one and the same there.
Sure. Now, how important are sealants?
So sealants are very important. They're a very good preventative measure to go in, and as I talked about that teardrop in those grooves, what we do is we go in and open that groove with a burr, or you can use a little sand blaster that goes in and cleans out that groove and opens it up. And I'll tell you, there's a lot of times that you'll open up that groove and you'll end up finding decay, and you end up doing a filling on the tooth versus a sealant. So the difference between a filling and a sealant is the depth. Once you go through the enamel into the dentin, it's considered a filling. If it's just in the enamel, it's considered a sealant. So a lot of times we'll open up those grooves and find that decay down in there, and by the time we take that out, it ends up being a filling there. But if we catch it early enough, as soon as those teeth erupt into the mouth, say at 6 years old or a little after, and then the 12-year molars, We can open up those grooves, get those sealed up, and that fills in that groove so that that bacteria and food doesn't have a place to hide down in there. That groove is so small that that toothbrush bristle can't get in there to clean it out, and so we end up with that decay in there. If we can go in there and clean that out and seal that up, it doesn't have that chance to do that.
And how long does a sealant typically last?
You know, it just depends. I've tried to figure that out. I'll have patients that, you know, we do them the same on every patient, and some patients will come back and they'll be popped off, 2-3 years. Some of them, they're in there 10, 15, 20 years later. So it all depends on diet. I think tooth composition probably plays into that factor as well. But, you know, the nice thing is, once we get it in there, even if it's not visible on the microscopic level, you still have a little bit in there to help keep that food and bacteria from getting down into the tooth. So usually once you have sealants on there, that even though you may not see it visibly, it still saves a lot of issues with the teeth down the road.
And at what point do you like to start putting those sealants on?
I like to put them on just as soon as those 6-year molars erupt into the mouth, and then as soon as the 12-year molars erupt into the mouth. We like to get those filled in. We usually don't seal premolars, and that's probably more of a from an insurance standpoint. Usually insurance will pay for it with molars where they won't with premolars. But you know, the kids that get premolars and molars done, I mean, you see next to zero decay in those kids, you know, for the length of their life there.
Okay, well, we want to remind our viewers that we are talking about dental health tonight with Dr. Jarrod Jones from Hayes. If you give us a call, 800-337-4788, he would be happy to take your call. Now, you mentioned a little bit about brushing. How often should a person brush?
Well, preferably at least 2 times a day, and if you can do it 3 times, that's even better. You have to kind of draw a balance. You don't want to do excessive because we do have abrasion. Where every time you go in there with a toothbrush and you put toothpaste on that toothpaste has some abrasiveness to it. Your whitening toothpaste have more abrasiveness than other toothpaste. So if we get in there and brush too much, we can actually wear away that enamel. And another important point is that you don't want to brush your teeth after you've had what we call an acidic challenge. Like after you drink a soda, you don't want to go in there and brush your teeth right away, because as I talked about, that chicken wire with the concrete, all that concrete's off of the chicken wire, and you go in there and brush it, and then that takes away that chicken wire, or there's a matrix on the tooth that wipes off. So we don't want to get rid of that. We want to let that mineral remineralize the tooth, and then you can brush your teeth. So I think they usually say about 30 minutes after that challenge, then you can brush your teeth.
Okay, and you mentioned the whitening toothpaste. How do you feel about the effectiveness of those whiteners?
I think whitening toothpastes are good for, if you have a lot of extrinsic stains, so tea, coffee, wine, things like that are going to stain on the surface of the tooth. I think it works really good. But as for what we call intrinsic stains that are within the tooth, about the only way to get rid of those is to do bleaching of some sort to get rid of that. And I guess over the years I've found it seems like if you'll do an in-office bleaching where we use a higher percentage of hydrogen peroxide or carbamide peroxide on the teeth, then we make trays and send you home with those. That just kind of jump starts the process, and we seem to get a better long-term result that way than just doing it with doing the whitening trays and things like that. But you know, they have some good products even over the counter, the Crest Professional White Strips, things like that do a really good job of whitening the teeth, you know, as long as you stay at it. And it may take you a little bit longer to get the results there that you're looking for, but they do a really good job too as well.
Okay, and do you suggest a manual toothbrush or an electric one? Without
a doubt, electric. Yeah, you know, manual ones are, if you don't have anything, they're better than nothing. But we see a marked difference. You know, the studies don't indicate that there's a difference, but I can tell you can ask my hygienist that you can tell the people that use an electric toothbrush versus a manual toothbrush. They're just cleaner. It also helps too if you don't have a lot of good dexterity to be able to get back there and get around the back side of the molars and in different areas. they do a great job.
And do you find that fluoridated toothpastes are more effective than those that are fluoride-free?
Yes. I always tell the patients, we have to use a fluoridated toothpaste. You need that fluoride because there's a lot of places we don't get fluoride anymore. They put it in the tap water in a lot of municipalities, but a lot of homes have RO, reverse osmosis systems that take it out, so you aren't getting any fluoride from that source there. And then a lot of people are drinking bottled waters or sodas or these other things, and we're not getting the fluoride that we need to strengthen that enamel and keep it resistant to those acidic challenges.
And at what point do you need to replace your toothbrush?
I would recommend replacing it every 3 months. Yeah, I mean, if you see the bristles and they're all splayed out, you missed the boat. You should have done it a while back. So and that's the other thing too that I like about an electric toothbrush versus a manual is I myself am a scrubber. You get in there with a manual toothbrush, and we see a lot of damage done on root surfaces and that where people just scrub too hard on the surfaces, and it wears it away, and it also can cause the gum tissue to recede. With an electric toothbrush, I tell my patients, just hold that thing and let it do the work. You don't have to get in there and scrub. And so it seems to work a lot better with the gingival recession and not causing those issues to get worse as time goes on there.
And how important do you feel it is to use mouthwash and to floss?
Oh, without a doubt. I mean, flossing is very important to get the bacteria out from in between the teeth. Everybody says, they come in, they do it. Everybody knows how often they should brush and floss. 2 times a day, I should floss once a day, but how many do it? That's more the struggle, is creating those good habits there. But there's no doubt if you floss, that goes a long ways to keep from getting the decay in between the teeth there. And a water pick is a great adjunct to that, to go in there and clean in between the teeth and really clean out those. I like the water picks that are now battery operated, that you can take in the shower with you and just fill it up and spray and keep everything nice and clean, and don't worry about getting it all over the mirror and everything else in the bathroom. So
Right,
they're really good.
Very good information. Let's talk about a little bit with the brushing with braces. There, it used to be that braces seemed like it was more for just kids, but now, a lot of adults are having braces. How do they keep those braces on their teeth clean? So
with that, same thing. I recommend the electric toothbrush to get in there, and probably the biggest struggle that I see is probably with our kids, with them brushing their teeth. If they have an electric toothbrush and use it, that's the most important part. If you don't use these things, they don't do us any good. But if they'll use that, it'll go a long ways to cleaning around the brackets and keeping everything nice and clean there from that standpoint. Yeah, it's a little bit harder to clean with those manual toothbrushes to keep that cleaned up, but an electric toothbrush does a great job. And the water pick, especially with the braces, does a great job of keeping things cleaned out.
Okay. We're going to go back to the phone lines. We've got John on the line from Logan. Hi, John. Go ahead with your question for Dr. Jones.
Yes, doctor.
Yes.
I have no teeth. I'm completely edentulous. I have 2 lower implants. How often should I see a dentist? I brush my gums every day. I don't use fluoride toothpaste. I use straight toothpaste.
Yes. Where you had the implants, it's not as big of an issue with the fluoride. The goal with the fluoride is when our teeth, the enamel's made out of what's called hydroxyapatite. And so the fluoride comes in and replaces the hydroxy part and makes it fluoroapatite. And fluoride is a lot stronger bond, and that's what makes it more resilient to the acidic challenges and things like that. So where you have implants, I don't care if you use the fluoride toothpaste or non-fluoride, just as long as you're getting in there and using that toothpaste to brush those and keep them nice and clean, that's a huge part. I like to see my patients with the implants and the dentures, I like to see them, as I would any other regular patient. I'd like 6 months, but at least annually I'd like to see them, just to make sure that there isn't something else going on. We always do oral cancer screenings when you come in for any exams, things like that. So there can be other things that we may pick up at those exams that we're not necessarily looking at just the implants. We're looking at the overall mouth and everything, especially with the dentures. You can have fungal infections, things like that we may need to address as well. So yeah, I like to see, like I say, at least a minimum of yearly.
Okay, well, thank you so much for being our guest tonight. That just about wraps up our time for tonight's show. Thanks goes out to Dr. Jarrod Jones from EyeSmile in Hayes. On our next Doctors on Call, we'll discuss mental health. You can email your questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital. Experts, neighbors, friends.